How crazy is it that there is a whole like term now, pre-COVID versus like post-COVID, and it's just wild to me that that's even a term.
My buddy sent me a text. He said PC. I was like, what?
Oh yeah, I've seen that too. Like, yeah, no, I saw BC instead of like before Christ, before COVID.
Yeah, that's better. That's better.
What's up, everybody? My name is Ricky, and welcome to another episode of Turn to Your Neighbor, the show where me and my very good friends invite you into some of our most intimate and sometimes ridiculous conversations and debates. And today, ladies and gentlemen, we have a good one for you. Now, as you know, Philly is shut down again, right? The coronavirus cases have shot up. And, you know, the mayor decided to shut everything down. No outdoor seating when you go to a restaurant. I mean, no indoor seating. You can only sit outdoors. No sports events for elementary school, high school, college, all virtual learning. And they're trying to even limit our social gatherings in your house, even around the holidays. All right. So we're going to talk all about that today. I got some special guests, some of my good friends. I got some returners. I got Jordan. All right. And I got some newcomers. I got my guy Burrow and my boy Andrew. All right. And today we're going to see how this goes. All right. This is new, a hot topic. So hopefully it's a good one. This is Turn to Your Neighbor. And today we're talking about COVID-19. Let's go. All right, guys. They shut us down. Philly is shut down again. How do y'all feel about that?
For me, like one of the most, the discussion started earlier today. Ricky and I were talking. One of the things I was frustrated about, like it's so hard to enforce everyone following certain guidelines. And with the cases spiking, you know, obviously action's got to be taken. But like my gym, and the gym is like, you know, big part of like my like wellness, you know, working out, and like my gym have gone to such excellent lengths to be safe. Like I was saying to Ricky earlier, like I honestly feel safer there than in the grocery store. And you can argue that like they're equally as essential. Like,
talk to Andrew Barrow.
Yeah, well, I see the beefcake over there. I see it. You know, you could argue that it's just as essential as far as wellness and keeping yourself healthy. And
that's a great point.
Like they have big doors open outside, and like they only allow 8 people in at a time. You have to wear a mask the entire time, sanitize, take your temperature as soon as you walk in, and then they have 10 by 10 taped off squares for the workout, and all the equipment is there that you're going to need for the workout already ready to go. So you don't even leave that area. And then like you want to drink a water or whatever, you got to go outside. And Ricky and I were also talking about the economic impact, like, you know, restaurants and what have you. It would be ideal if you could have a situation where places that are following guidelines could continue to operate. But, you know, in a city as big as this, it's tough to do. And then the other thing that I thought was really, that Ricky's like, you have a problem with everything shutting down. And I'm like, well, what I really have a problem with is like forcing businesses to shut down without offering any sort of relief to the businesses. And
that seems so cruel. Like,
yeah, I mean, I feel like that's where we're getting left high and dry. And then we got into a discussion about like government and what the role should be. So it's kind of like, if you're going to force people to shut down, like there's got to be some sort of relief. I've actually listened this morning that show, The Daily from the New York Times podcast, and yesterday it was about how they dealt with the second wave in Europe, and they started shutting everything down there like a month ago, and everything there was accompanied by, they said, okay, we're going to shut everything down, but here's what we're going to do for you to help support everybody. And that whole piece is just missing here. They're just like, good luck.
Yeah. they shut you down and they give you $1,200 to last 3 months. You know, it's outrageous. It's crazy. I don't.
Yeah, it's. I feel like it's almost, it should be like a planned thing. Like, you know what the relief is going to be, and let people know, like, hey, this is coming. This is what's going to happen. This is what the relief is, and then boom, shut down. Not just shut things down and then we're going to figure it out afterwards.
Do you feel
Thinking
like,
on just real quick, thinking on a different side of it too, depending on where you're at, like I know, you know, Center City, Philadelphia, this could be a different ball game, but this could be such a unique opportunity for communities to come together and support each other at a real like task-based level. And at the same time, though, they're advising don't do things like that, at least in the physical sense. And I mean, I'm not super close to anybody in my community, unfortunately, but for places like that, the opportunity, you know, it is beckoning, but again, they're saying, you know, stay away from each other. So it's so complicated. Like, you know, I know you guys brought up government assistance, but that aside, even.
yeah, do you feel like they have to, but all that being said, do you feel like for the virus to go down, the numbers to go down, they have to do this?
Well, look, they know that certain things or certain interventions are effective, and that's, you know, they're not doing the shutdown to be like, this is fun. Or
It's
like,
not an experiment.
yeah, or to be punitive. Like, they know if we limit the contact, then we're going to stop the spread. And the ultimate concern, obviously, is the capacity of hospitals. I mean, well, saving lives is the bottom line, but like, you know, the capacity of hospitals to be overrun, and you know, it's happening in a lot of parts of the country.
What you mentioned about the hospitals, even, I think that's where it starts to get politicized, right? Philadelphia is different than Bucks County in terms of hospital residency.
Capacity or,
Yeah,
Right,
capacity. And then, you know, people start arguing for where they are instead of, you know, kind of the broad sense of Pennsylvania or Southeast Pennsylvania or the country, you know?
Right. There are some hospitals that got overrun. That's accurate. But there's also other hospitals that actually had to lay their employees off. I have a friend who got laid off because they, you know, were ready for this COVID, and, you know, they made certain COVID sections in their hospital, and it never came.
my grandmother passed a few weeks ago, and we had a very small funeral. It was outside, 10 family members there. We went back to my aunt's house to have just a little luncheon and gather together for a little bit. And we were together indoors for, you know, maybe an hour and a half. And, you know, somebody, we think it's probably my aunt, but somebody was positive, and 8 out of 10 of my family members tested positive, just from being together for an hour and a half, you know, in that setting.
This question is for the Jordans. One of the reasons I asked you guys to be a part of this episode, because you guys both and you guys both had COVID. You guys were both diagnosed positive for the coronavirus. Tell me about that. How was that experience?
You can go ahead, Jay.
All right, yeah, I'll go first. I mean, violating all different type of HIPAA rules, but that's cool.
Right?
No, but
Glad you guys are both doing all right, by the way.
Yeah, thanks, man. Yeah, it was. Well, I was talking to Jay about it a couple weeks ago, actually. It was just different from any type of sickness that I've ever had before. It just felt like it was lingering. It felt like I'm getting ready to get over it, and then bam, actually, no, you're not. You know, it's definitely something that it sucks. Honestly, I'm just straight up. It sucks if you get it. Like, obviously, you could have mild symptoms, you could have severe symptoms. I was mild, obviously, but it completely sucked. But
did you have your taste? Sorry for interrupting. I'm just curious.
No, I lost my taste and smell for a few days. Yeah, so
that would be prison.
That would be the hard part.
I'm sorry, bro. What'd you say?
How long were you going through it for?
So it was a good 10 days. It was like very consistent. It wasn't like up and down, like feeling better one day, feeling better, or not feeling better the next day. It was very consistent. It sucked, honestly. But the one thing I would say about it is getting it, I wasn't very smart, right? In how I received it. I was in a crowded area on vacation. And I knew I was at a high risk, right? I did so much beforehand to keep myself and my family safe And then we just had a stupid week of vacationing because we were just kind of sick of the quarantine, really. And it's just the dumbest thing you can do. Like, quarantining and keeping yourself safe from everyone is obviously the smart thing. That's what the CDC recommends. It's real. Once you get out there in the world with other people, you can get it just like that. And that's my biggest takeaway from it. Like, the regulations that they put in place are for your safety. Because once you go outside of that, there's no telling how quick you can get it. So go ahead, Jay.
Thanks, man. Yeah, so a similar thing, and I mean, I'm sure it happens to a lot of folks, is my wife and I, we went to see our friends. They just bought a new home. They're sisters that all live together. And we honestly don't know where it originated. And to me, I kept saying to them, I was like, it's not important to me. Just everybody get healthy, because but it was a gathering of maybe 12 to see this new house they just purchased. And maybe like midweek after that Saturday, this was October 24th, two of those ladies ended up positive and the one sister didn't, fortunately. And then I went for a run that Monday. I worked out Tuesday again, and I was feeling off, kind of like the onset of a sickness. But I brushed it off, and then it started hitting me like a grave fatigue, and then the body aches they talk about. It's not even like an ache. It's just like you're so lethargic. You don't want to move the same way. I sit at a computer all day for work, and I didn't even want to do that. Like, I found myself I wasn't myself. And then I said, okay, I'm getting paranoid, but maybe it's just that. And then we finally decided to get tested. I think that Friday, like 6 days after, and it comes back a couple of days later. I was positive. My wife, though, who never left my side the entire time, was negative. Fortunately, I've been saying to people, I'm just like, honestly, I'm so fortunate with my experience, and the same with Jordan, I'm sure. And I'm even more glad that she didn't get it at all. And I'm hoping she's safe for the long haul, but that we both are. But yeah, just the symptoms kind of like went through. The one thing I didn't have was stomach issues, but I had every other symptom you see on Google, on wherever. And they overlap slightly, but I kind of went through like each one over the course of like a week and a half. And then the ending, and what I'm still coming off of, is losing taste and smell, which again, I don't recommend it. Obviously, I didn't choose this life, but I'm just eating everything: crushed red pepper, hot sauce, like every meal, Old Bay, just anything I could think of that would really be pungent. Sour stuff worked too. But so some solutions out of this quandary here. But one thing that took an even greater emotional toll is I'm hitting points where I'm wondering, am I going to be okay by the end of this? But then I get a message shortly after, in the middle of my bout with this, that my grandmother of 89 years old, and Beryl, I'm sorry to hear about your grandmother, brother. She was diagnosed with COVID. But I was telling some of my friends just recently, fortunately, she's fine too. And it's just, I'm like, it's so indiscriminate, but then it seems like it's just strange in who it claims, what it does to you. You know what I mean? It's really bizarre. I was just talking to another friend who was positive. He works in a prison, so he kind of was just counting down the days for that result. But yeah, it was a good like week and a half struggle of just, my cousin asked, was it the most sick you've ever been? I said, not exactly. Like, I had the flu when I was a kid around the holidays, like twice. And that was definitely worse. But this, with everything going on, and then my grandmother at the same time, they say it's not good to kind of get in a depressed state when you're kind of ill or injured or what have you. And I felt myself get in there, and I said, all right, just keep yourself busy, focus on family, focus on friends, and focus on recovering. And again, it wasn't up to me. It was up to God. It was up to the virus itself. You know what I mean? But I'm just feeling very fortunate, because I know not everybody is, of course.
I haven't actually experienced COVID, but working in a nursing home, one of our policies for new patients, obviously we test everybody. I get tested every single week, but for new admissions, they are in complete isolation for the first 14 days of their stay in their room, and that's it. These patients come in, and some of them are already at a pretty physically high level, but to see the mental toll that isolating somebody can do, even for a short time, 2 weeks, it's unbelievable to see like how negative those effects can be. It's tough. Do you quarantine and lock down, or do you try to have some sort of social life, or work out something? It's very difficult. Like, I watch patients go from walking on their own to literally being bedridden in 14 days. It's crazy.
Drew, first off, Beryl, this is my wife, Maribel.
Hi.
Oh, Maribel.
What up, Marty?
But we have talked so many times throughout these last few months about how we've been very fortunate in that regard too, is despite all this isolation, we've never been truly isolated. We miss our family, we miss our friends, but we've always had each other. And we're very fortunate in that realm because it kind of keeps you motivated, keeps you going, keeps you occupied, and it's real normalcy. And Drew, what I was going to add, and Jordan, what I was going to add to you guys, your statements is that, not to mention somebody like Jordan and I, right? There's so many people in the world right now essentially calling us idiots for something none of us can really control. You know what I mean? I even had one of my relatives, I told him just to reach out to family, say, here's the situation. And he's just like, were they wearing masks at that gathering? I'm like, obviously not. You know what I mean? And he's like, come on, man, you get home, you take a shower, you wash this, you wash that, take off your shoes. I'm like, we were being safe, man. We slipped up. Not to mention, we very, very fortunately, again, we got married in the middle of all this. And
Congratulations.
thank you.
Wedding, by the way.
What'd you say?
I said a beautiful wedding, by the way.
Thank you, man. Which was like extremely nerve-wracking. But we were so blessed to just have everything go smoothly, and health-wise and the event itself.
Thank you, Lord.
Yeah.
Yeah, I mean, and that's one of the concerns that I have now, like heading, and for everybody has right now, that we started this conversation out talking about the lockdown, or not lockdown, but like the new shutdown orders that are coming down. And like, I said, like, we're heading into some cold, dark, like months, and that isolation, that's real. I mean, I live by myself, and even back in the spring, yeah, I mean, it was messing with me like big time. And then as soon as things started to like get nice out and open up a little bit, here come the protests. And I live right by a precinct here down here, and like, it turned into like, police zone down here. I mean, I had to show ID to get onto my block. Everything is boarded up everywhere, and like, it just started to get to the point. I got to get out of here. I went out to California in June, just to like, I was like, I got to get out of here. I had trepidation about flying. But actually, at that point, it was like, I was so nervous about flying, but it was like ghost town. It was like seriously out of like a zombie movie or something. Like, there was, at Philadelphia airport is always just insane. Like, there was no cars. You walk in, there's hardly anybody in sight. Like, nobody was anywhere. The plane, 200-seat plane, was probably like maybe 70 people on it.
Let me get a Cinnabon.
It was weird, man. But it wasn't, at least like, it wasn't as nerve-wracking as I thought, because you're distant. But I was glad I got out of here, man, and just like had that reset. So worry about a lot of people heading into these winter months.
Yeah. So for the sake of time, I'm gonna bring it full circle. I'm actually going to present this question to Maribel first, because she just joined the boys club. So we talked about, Philly shutting down. How do you guys feel about the government making that call? Like, do you feel like the government should have the power to tell businesses you can't open, or families you can't gather, or things like that? Like, how do you feel about the government having that control and like taking away what some people would say our freedom?
So I can see why a lot of people are upset with that. And to an extent, I get it, right? Like some businesses aren't going to make it out of this. Some businesses have already had to close down shop for good. I think that the government should be able to provide some sort of subsidy in order to support everyone, you know, with rent, with businesses, with whatever benefits, whatever needs to happen. But at the same time, it's a public safety matter. And I feel like it's like for the greater good, right? It's such a short amount of time in the span of our entire lives, right? Like say we live to 80, 2 years of our lives out of 80 years is really not that much when you think of it in that way. And I mean, in the beginning, I commented on your post on Facebook, Ricky, but in the beginning of the year when we first shut down, it was to flatten the curve, right? To keep hospitals from being overwhelmed so that they can continue to serve those who like needed critical attention and serve others. But they like put everything else on hold, right? If you're in for surgery, if you're in for an eye doctor appointment, if you're in for just a regular checkup, don't come in. We're focusing on just people who have serious like COVID issues and need to be on ventilators. So they were already reaching their max and they couldn't help everybody else. So I think the idea is still to flatten the curve, right? So that hospitals can still operate and not be so overwhelmed. And I think when you think kind of unselfishly, think about your neighbors in that way. I mean, I get the isolation as well. There's ways to work around that, right? COVID test is available. We've gotten tested twice already, and we're already thinking about getting tested a third time before we visit people. Get a group of friends, say you're all gonna get tested, and then quarantine for just 2 days until you get the results. Everybody's negative, boom, get together.
Quarantine.
As long as it's not a group of 10 or more, because then you're breaking the law.
All right now.
Honestly, around our wedding, though, to her point, I mean, again, I think we were just fortunate. It was God's plan. We did, you know, bridal shower, 2 weeks quarantine before. What was the next event? Your bachelorette party, 2 weeks quarantine. And then 3 weeks later, I think was the wedding. And then after that, we were kind of just isolated up in Maine for our honeymoon, which is a great place to vacation in this day and age, by the way.
But back to your question, Ricky, like I think I'm okay with the government stepping in because I think in the beginning people were afraid enough to stay home and we were able to flatten that curve. And then all of a sudden it went nowhere. Like people were just like, I'm going to go out. I'm going to do me. I'm going to get together. And people forget that this is still like a pandemic and people are traveling, getting together. And we did too. We loosened up. We quarantined strictly from March to like July, maybe even August. And then August, we did our every 2 week thing. And then after our wedding, we were like, we're hanging out with everybody. We don't have COVID. And then boom, Jordan gets COVID. So like everybody just loosens up. And I think that's where the government is stepping in to say, well, if we can't rely on you as responsible adults to be responsible for a short amount of time so that we can keep hospitals from being overwhelmed, then we're going to put in some regulations. And it does suck, but it feels like we're children, right? We can't follow the rules. And so they implement stricter rules for us to follow.
Well, it's kind of like a perverse situation because, you know, and they did, I remember like way back in the beginning, like Fauci like warning about this type of thing, because he's like, the whole thing is you take these measures and they seem extreme, but they work. And then, but since they work, you look around and you're like, well, everything's cool because they're working. And then it flips on itself. You know, just to speak to the government issue, again, I'm sorry, Mary, what's your name again? Maribel. And you were making the point about needing the subsidy and the relief and that type of thing. And, you know, one of the things that's frustrating to me is like we live in such a reactive society instead of being proactive. And it's one of the things that led to us being unprepared for this because the government was like, pandemic, maybe it'll happen, but probably not. So we're not going to prioritize that. And, you know, then you get in a situation when you're dealing with it. And then it's like being presented as an either or choice where you either shut down, totally isolate, or you're just going out being wild and do whatever you want. Like, I think like as a society, like there's got to be a road forward where we're just able to live smarter than that. And like, you know, that's where we had touched on this earlier, just about like consistent messaging and all that. But like, what I think our government's missing the boat with, as far as the relief and all that, is if you support people and get them through this, and we all stick together, and we flatten the curve, and people are supported financially. You fund, give businesses enough money to stay open and keep in business. That will then get us, more to a better situation economically in a shorter amount of time than just saying, okay, well, you're shut down and we're just sort of SOL until we come back up for water. So, it is a great, one of the, there are some signs for optimism. I feel like a lot of this conversation has been so gloomy, and it is a gloomy topic, but the vaccine news is definitely, a promising thing. And, there being a couple vaccines now that are looking really promising. And, it may take a while to build up the infrastructure, the capacity to get everybody vaccinated so we can go back. But one thing I keep telling myself, and, before I was a school administrator, I was a history teacher, and I keep telling myself, of my roaring 20s came after the pandemic of 1918, the Spanish flu.
Good point.
All that stuff came after. So like you were saying, Mary, about like in the zoom out, like the grand scheme of things, like, yeah, that's something that sort of can help you get through. I'm thinking like it's going to be tough, but better days are ahead. It's not going to be like this forever.
I hope it leads to more innovation in myriad senses, to lead to that, hopefully, economic growth following this. Just going back to the school situation, though, this is a wide turn, but going back to the schooling situation a little bit, and also kind of commenting on free enterprise and the regulations that hinder that or not. So my father just shared this with me yesterday. Jordan, you would know the school, but there's a parochial school in Wilkes-Barre, Pennsylvania, where I'm from, and a few years ago it consolidated a bunch of Catholic schools. So it's got a good population at this point, but my younger sisters go there. And my dad actually shared on the phone yesterday that a big reason for their hybrid model they were doing, which was actually every other day. And my stepmom kept saying, maybe they do like a 1 week on, 1 week off type thing. It'd probably be safer for the kids, but they were doing an every other day model. And my dad said, what I'm hearing is that they want to keep the kids in school also because they don't want to lose attendance. And at a parochial school, there's a fee for that, obviously, for them to attend. And I don't know if there's profits involved, but there are staff they have to pay, of course, at the least. And just hearing something like that, let's keep the school open for high school kids so we don't lose on our attendance numbers. That's the point where, okay, regulations help with something like that. Like I totally understand free enterprise, but when corruptions and that type of darkness sinks in, it's where things go awry. And like anything, I wish there was more of a balance there. But
From what school up there, Hoban?
That's what it used to be called, but it's called Holy Redeemer now. Yeah.
What's it called now?
Holy Redeemer.
Redeemer.
I'm very familiar with that area up there.
Nice. Born and raised, me and Jordan.
Yeah,
I spent a lot of time up at Harvey's Lake.
You were smack dab with the Hoban part, though.
I went to Myers. GAR.
Shut up.
Andrew,
One of
you
those.
Say something.
Yeah. Jay, you just mentioned corruption a little bit, and people don't seem to realize. I mean, the government is just people too, So it's not like there's just corruption on the private sector or in free enterprise,
Totally.
We have the DC mayor that went to Biden's election party after she, talked about how not to travel, and then she said it was essential travel, and she went to a party, which I guarantee you was more than a gathering of 10 people, right? You have Pelosi getting her hair done and, saying she was framed and coming up with some crazy story. It's like, no, you're an average person and you want to get your hair done, so you got your hair done. Who cares? I kind of I feel like I'm going against a lot of you guys here, but I just, I'm a big believer in choice. You guys said yourself that you guys made the decision to go, you went to the vacation, Jordan, you went to visit and see the new house, right? That's on you, That's not my fault. That's not the government's fault. That's nobody's choice but your own, you know? If you stayed home, you wouldn't have gotten COVID, right? Because of those decisions, I don't think that my friend needs to shut down his brand new gym that is literally how he puts food on the table, right? And I use the gym, and people say, oh, it's just because you love to work out, but it's the bigger picture, right? It's people being able to provide for themselves. And when the government steps in and says, no, we're not allowing you to provide yourself, take your $1,200 check and shut up and stay home, I think that's ridiculous. Everything the government can provide for you, they can take away. And I believe in the freedom of choice. You know, it's simple as that. If they want to close public things, I absolutely, that's their domain. Sure. But don't you dare tell a private business what they can and cannot do. I think that's overstepping greatly.
I say this not even to refute you, Andrew, but just regardless of assistance or total opposite, freedom to do whatever you want, and we're going to leave you high and dry. I think we all just have to come to the realization that we do all, as individuals or as families or as schools, what have you, we have a role in this. And, just like succeeding in online education, I think that's really dependent on a student and a family claiming that education. And just like succeeding in this, it would take individuals kind of claiming their individual responsibility in this, because I think we all have one. And I think we all know that deep down.
Yeah. And to what you're saying, Andrew, and that's, one of the points I was trying to make before, like because at least in my view, like it doesn't need to be this either or. Like there should be, and that's what, why I like so frustrated with my gym closing or like them shutting down all these places in Philly, is because I feel like there is a path forward where if we had good sort of public health education and awareness and clear guidelines, and they had some way to enforce or hold places to these standards, so that there's some accountability there, that there's got to be somewhere in the middle where businesses can be able to operate in a safe manner, and then people can make those choices within a safe environment. And that's why these decisions become so difficult, because it's like you don't want to, I'm sure the government again doesn't want to be telling people you can't do this or you can't do that, and then they're looking at those other situations with the public health numbers and statistics of what's happening, and it's like it's too hard, it's too complicated to do that comprehensive approach, so we're just going to shut it all down, which I mean, it's really hard. And then people do have to make also a decision, like you said, putting food on the table for your family. I mean, okay, COVID obviously it is what it is, and we're living through it. But if you're somebody who's you have to, this is surviving, and you need to provide for your family, and like being told, having that taken away from you and having no say in the matter is wrong.
Think about this. Think about, I could go over to that gym, or not. I'm sorry. Say I went over to it. There's no more than gathering of 10, right? So I could go over to my friend's house and work out, no problem. But if I went into his gym and I gave him $5 to work out, I'm breaking the law. You know what I mean? Like it's just
totally
very scary when the government has that kind of say in your life. Like that's terrible.
There becomes an arbitrary element to it, which kids, I hear where you're coming from, is what I'm saying.
Right.
And it just, overall, it's just such a, like, I just, and pardon my language, but like you're texting out. I just got so frustrated the other day. I just like texting out to all my text chains with friends. I'm like, fuck COVID. Just like,
we've all said it.
It's just, listen, like none of us in our lifetime have lived through something like this. And, probably never thought we did. Like, I think about the surrealness of it a a lot, walking around the street, seeing everyone in masks and like, having things boarded up and closed and just like, it's surreal almost living through this experience.
I'll take it a little bit further if you don't mind, real quick. How do you guys feel about somebody telling you, again, government is literally just people, just like us. How do you feel about them telling you what's essential in your life and what's not? Like, your gym is closed, but your local liquor store is open. Like, doesn't that kind of bother you?
Can I comment on two things from
Of
what you were
course.
saying earlier, Andrew? So first, I'm probably not up to date, but is it law? Like these restrictions, are they law?
In Philly
Yeah.
right now, in Philly it is right now, or as of Friday, it will be.
Friday
And
will
in the
be
state
long.
of Pennsylvania, it's law as well.
In Jersey and California it is. In Pennsylvania, I don't believe yet. I don't know the rules for everybody.
So here's the thing, like, I'm sure we break a lot of laws, right? Like, I text and drive when I'm not supposed to, but that's the law, and nobody's in the car with me. And unless I get in an accident, then nobody's going to know that I'm doing that, right? My brother lives in Maryland, and he's like, I'm still coming to Thanksgiving. Are they enforcing this law or this restriction? How are they going to catch me? There's no enforcement. I'm still coming to Allentown for Thanksgiving. I'm going to still see my family. So I think people still have a choice, right? But like, you take a risk, and that comes with the choice that you're making. Like the choices that everybody else made all this time, whether to have a wedding, to go on vacation, do whatever, you still have that choice. There's just going to be consequences and risk. The consequence might be that you get COVID, that somebody near you dies, or everybody survives, nobody gets sick, and all is said and done, and it's good in the end. So you still have a choice there. And then as far as the gym, with any business, I know it's difficult for a lot of businesses, but like, my gym is a small gym. It's not a chain or anything like that. And when COVID first hit back in March and they had to shut down, they like were on their feet. Strategies, let's keep this afloat. Facebook live classes, Instagram live classes. Then when things started to slowly reopen, they were like, let's do outdoor workouts. And they took over a parking lot. They would set up the gym equipment. And then I know a friend who like opened up a business during COVID that's outdoor workout only. They like bought a truck, loaded it with equipment. They drive it to a parking lot. They set the time. They post it on Instagram. Tomorrow, 6 a.m., 8 a.m., 12 p.m., 2 p.m., come through. We have the equipment, $8 a class. And they're making
food truck. That's a food truck.
Exactly. So like, you have to be innovative. And I think this is a time to like think of strategies, because this isn't going to be the first emergency to hit, right? Like, you might face other emergencies, health issues that take you out of your business, and you have to figure out how to support your family. I think this is a good time to step back and think of that safety net. Even if you don't have your own business, like I'm self-employed. I lost a lot of my work. I lost like 80% of my work, but then that led me to sitting down, looking at my finances, and then figuring out, how am I going to make this work between him and I, between all our bills? And then how am I going to make sure this doesn't happen again, right? Like, I'm going to create a safety net. I'm going to look for the best, APR on whatever, or APY on whatever credit card or savings account, and throw my money in there, save enough so I have that safety net. And I think that's important for everybody to do, and maybe we overlook that when we're starting up our businesses and going about our lives.
Go ahead, Jordan.
All right. So that was, Mary Bell, was really good.
So well spoken. Like, sorry you have to follow that.
I know. Listen, I did this to myself. I waited to go last. So my thing about COVID and the regulations, I think we need to be thinking of others, right? We need to be doing this as a society, not what I want out of it, what I feel I should be able to do, right? What Mary Bell was saying about being innovative, that, and as bad as this might sound, that's why I don't think as much of the small businesses, how much they're affected by it, because there are a lot of small businesses that are thriving right now because of it, because they're innovative, because they're thinking out of the box of how I can survive through this. My biggest concern are the people that don't own their own businesses, that were before COVID, were living paycheck to paycheck with children, and they're struggling already, right? And then their jobs get shut down and they have nothing to turn to. Those are the people I'm more concerned about than business owners that can be as innovative as Mary Bell was just speaking about, that can turn, into survival mode. But like I was saying, go back to, it's about our society. It's not about individuals, what we think we want to do individually, right? We have to do it for each other. Like, if we know that the elderly population is the most, they're most vulnerable to this, then we need to stay away from them. I haven't seen my grandparents. I've seen them one time since March, right? So I'm actively doing that. I understand that it's a choice, right? It was a choice that I went on vacation, but while I was on vacation, numbers started spiking. Pennsylvania put in this thing where if you come back from any of these states, you have to quarantine yourself. While I was already gone, had that been a thing before I left, I would have never went. See what I'm saying? So I think that regulations are absolutely a must because I cannot trust my neighbor next door to care about my health, right? So I don't know. That's just how I feel about it, and I feel pretty strongly about it because there's a lot of people like there's people on the spectrum all over the place. There's people that literally think COVID is not even a thing. There's people that know it's a thing, they don't care about it. There's people that care about it, but they're not worried about it, and there's people that care about it and are worried to death. Right? There's so many different people that I can't trust. I don't know what you think, so I can't trust that you're going to have my best interest at heart, even though I have yours. Right? I literally was walking. I forget where I was. I was somewhere, and I had my mask down a little bit because I couldn't breathe. Right? And I seen someone coming by, and I pulled it up, not because I was afraid to get it from them, but I was worried about how they thought of me not having my mask. They don't know if I have it. I don't know if they have it, but I'm thinking about them, so I pull my mask up. Right? Mm-hmm. So it's little things like that. We have to work for each other, and if we can't work for each other, the government has to regulate things to make sure that we stay safe, right? Like Maribel said, flatten the curve. It's not about, see, if you give people choice, we're accepting defeat, right? We are thinking about living with COVID rather than beating COVID. I don't want to live with this. I want to get through it so we can get back to our normal lives.
Yeah,
that's just how I feel.
And I agree with a lot of what you said, Jordan. And it's the like you said, the issue with choice is that it's like a domino effect. And so if one person says, well, I'm going to make this choice and, go do this because for whatever X reason, but that choice is not in line with what supports public health in the midst of a pandemic, then that's one person, right? But then if any other person, if everybody, just that slope just slips right down, and then you have a situation where I think like if everybody stepped back, you took all the peripheral stuff, all the conditions, if we're just like in a vacuum, and it's like, what's the most important thing? I think all of us as like decent, good people would be like, people's health is the most important thing, that people are okay and that they're healthy. And if you take that all away. And so, that's where we get into a situation where, guess what? What we're doing is not working and people are getting sicker and it's getting worse. So, now we have to intervene. So, again, it's going to be, and if you disagree with how things are being done, there's ways to voice that and try and advocate for solutions. And that's why I sort of keep going back to like, people being able to communicate and work comprehensively and and live smarter, work smarter, and come up with solutions, innovate, as has been mentioned. But we will. It's just like for myself, like I just like really keep the faith. Like it's going to be rough. It's going to be a rough ride, and like we'll get through it. But like conversations like this are essential. Keeping connected with your people, in whatever capacity you can. Thank goodness for Zoom and stuff like that, because at least you can like have some connection. Like I said, I got this weekly poker night to have with my cousins and a couple of buddies. Like it grew out of COVID. Now we love it. Like we look forward to it every week. Like
yeah, that's awesome, man. I wouldn't have this podcast if it wasn't for COVID. So I appreciate.
Hold on. Let me get one more point in real quick.
Okay.
Before I forget it. The thing about, so we're talking about like choice, right? And I feel like I'm losing my thought. Hold on. I don't feel like choice, we can't choose to just be safe and open everything back up, because then, like I was saying, we'll never get rid of this. It's just going to continue to spread. The numbers are going to continue to spike until everyone gets it, and then it's just gone. I don't see that happening either. But we can't just, like, there has to be a plan in place. It can't just be, you know, do it amongst yourselves, be safe amongst yourself, and live your regular life. We have to have a plan in place, whether it be, I mean, it's going to have to be a government plan, because we're not going to have people agreeing on what to do.
All right, so for this, we're out of time, guys. We are.
Oh.
Yeah, but since this is my show, I'm gonna get the last word. This is tough. It's a really tough thing, and it's very unfortunate. There's been a lot of deaths, a lot of financial loss. But we're all in this together. We might have different, views on the solution, but we need to work together, be smart. And sometimes I feel bad that it's not such a high priority to me right now, because I have so many other things going on. I haven't directly been affected by COVID. So sometimes I get that guilt, like maybe I should care about this more. And like, even with the government making decisions for us, I'm kind of desensitized to that. Kind of like, as a black man or a person, who grew up in a poor, lower income neighborhood, I'm kind of used to like regulations and people telling me what I can and can't do, and having to take initiative, right? So like, this is kind of like, all right, well, what we got to do what we got to do type thing. And I feel like I'm used to the we got to do what we got to do what we got to do mentality. And a lot of people, because this is one thing that's affecting everybody, a lot of people might not be used to that. I'm not saying right or wrong. I'm just saying sometimes I have to check myself, like maybe, because I'm used to having to be innovative and thinking outside the box and going behind the government's back on some things in the community that people do to survive. It's not really this isn't new. It's a new situation, but the feeling isn't new of, loss and having to make things work when things aren't the way I expect them to be, or to be in the best situation. But that we are out of time. So I want to thank you guys for signing on and joining me. Jordan, Black Jordan, White Jordan. I can say that? All right, cool. Burrow, Maribel, thank you we needed you. Seriously, thank you for coming. Andrew, my guy, my brother, appreciate you, man, for coming on.
Real quick, can you edit this in? One tiny little point. I wanted to say it and I forgot it. Please, 10 seconds.
Go ahead.
This is not a knock on anybody in this conversation at all. You and I talked about this a little bit, and I got snippy with you, and I apologized right afterwards. It seems like a lot of people that are for the shutdown and the lockdown either have a passive income, or they're lucky enough to live with their parents, or have just other means of income, right? And it's easy to say, oh, well, I feel bad for the people that are paycheck to paycheck. But if you're not living it, then you don't really understand. And you and I talked about that too with some other topics that you're very passionate about, right?
Yeah.
That I've worked on a lot to better understand.
Yeah.
So that's just it. It just seems like the people that it's a lot easier to issue shutdowns when they don't affect you, I guess is what I'm trying to say.
Yeah, it's easy if you're not going through what that person's going through, it's easy to just be like, you should do this and you should do this. But it's like, you have no idea how it feels to do what you just told me to do, because you've never been in the situation I'm in. Yeah, that's a conversation for another episode, my brother. I thank you guys for watching. I know you might not be able to trust your neighbor right now, but make sure you turn to your neighbor and share this video with them. Make sure we want to keep the conversation going, guys. Leave comments on how you feel. What's your opinion on the shutdown? Do you feel like, this is the best thing that needs to be happening? Is the government taking the best approach? Do you even feel like the government should have so much say in personal affairs? Let us know what you think. And until next time, make sure you like, share, subscribe, and we will see you next time. Peace, guys. Thanks for coming on, man.
Thanks for letting me join so late.
I actually wanted you and not Jordan, but I had to ask him.
I think it would be easier if people just were smarter, right? Like, I wish the government didn't have to step in either and force us, right? Force this mandate, force these restrictions. But there was a need for that because we might be safe. We might, quarantine, decide to get COVID tests, get together, play it safe, avoid certain people, but not everybody is doing that. And it kills me that some people think that this is a hoax. And those people are going to continue doing what they do and potentially contracting it and spreading it. And I feel like restrictions are for those people. Like when we talk about rules being made, it's not because everybody's unable to follow the rules, but like if you have a group of people who really aren't following the rules or aren't able to control themselves or behave or play nicely, you got to set up rules for everybody, but it's really for that group of people. But unfortunately, it's all of us.
Yeah, because as a society, it would require us as a society to agree, and that's not happening.
That's never going to happen, ever.
When I first lost all my work, I was like, holy shit, what am I going to do? But I was also like, this is pretty serious. My work involves me going into hospitals, into schools, into businesses, into all these different places and literally interacting with different people every single day. And I was like, before it even was big, I remember like March 11th, I was like, I think this is going to be big. I don't think I'm comfortable coming to work anymore. And like, I work with a deaf blind person who literally has to put their hands on me to work. And I'm like, I don't know if I want you touching me right now. But then it was a big thing. And I was like, okay, people are dying, but how many people are dying? Not around here. And then I knew somebody who died who was only 30 years old, super healthy, played sports in high school. We graduated together, cool ass kid, died. And like his messages on, like, if you look on Facebook, he's like, guys, I have COVID, but they think I'm going to be fine. Guys, I'm going to go home tonight. And then all of a sudden, pray for me, like a day later. And then boom, he died. And it's just like, holy shit. And then you start to know more and more people getting it. And then how sick they get is so different. So I think like keeping that in mind is so important.
Like, I don't agree with anything you said, but I love the way you said it.